Your doctor has recommended that you have a hysterectomy. But what does that actually mean? Hysterectomy is the removal of the uterus, the organ that holds and protects the fetus during pregnancy. Hysterectomy often also involves the removal of other parts of the reproductive system, including the ovaries, where eggs are produced, the fallopian tubes, which carry the eggs to the uterus, and the cervix, or neck of the uterus. There are many different reasons why a doctor may recommend this kind of surgery. In many cases, disease or the growth of abnormal tissue will lead a doctor to recommend the removal of the uterus. In some cases, unusually heavy menstrual flow and the accompanying discomfort may make hysterectomy an important treatment option for patient and physician to consider. But no matter what the reason behind it, you should be aware that the removal of the uterus and other reproductive organs is a serious step, and it can mean significant changes in your life. After having a hysterectomy, you will not be able to have children, and if your ovaries are removed as part of the procedure, you may even need to take medication to replace hormones that your body once produced on its own. So make sure that you ask your doctor to carefully explain the reasons behind this recommendation. In the case of hysterectomy, the alternatives to surgery depend on the nature of your particular medical condition. If surgery is recommended because you are suffering from heavy menstrual flow and extreme cramping, then choosing not to have surgery may only mean that you may continue to feel discomfort. But if removal of the uterus is intended to cure disease or treat abnormal tissue growth, refusing surgery can have serious, even life-threatening consequences. In any case, your doctor has recommended this procedure because he or she believes that in this case, surgery is in your best interest. As you already know, hysterectomy means removal of the uterus, and only the uterus. Many people use the term hysterectomy to refer to removal of the uterus as well as the removal of the ovaries and fallopian tubes. Because of the common confusion of the two procedures, it is very important that you discuss with your doctor exactly which parts of your reproductive system will be removed during surgery. The decision whether or not to remove the ovaries is important because the ovaries produce important sex hormones. Removing them may have an impact on your health and even your state of mind in the future. Many people who have had their ovaries removed find that they need to take hormone replacement medication for many years following surgery. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to an operating table. The anesthesiologist will begin to administer anesthesia, most probably general anesthesia. The surgeon will then apply an antiseptic solution to the skin, place a sterile drape around the operative site. After allowing a few minutes for the anesthetic to take effect, your doctor will decide whether to make a vertical or horizontal incision. An incision is made cutting through the skin and muscle of the abdomen. Next, the surgeon will inspect the general condition of the abdominal organs. Once the ovaries are exposed, the uterus can then be separated from the bladder. Next, the fallopian tubes are tied off and cut. All arteries and veins connected to the uterus are tied off and cut as well. Now the uterus can be pulled upward. This stretches the vagina, allowing the surgeon to cut the uterus free at the cervix. The surgeon closes the top of the vagina with stitches and provides added support by attaching the ligaments that once held the uterus in place. The incision is then closed and a drainage tube may be left inserted at the site. Finally, a sterile bandage is applied. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. As a normal effect of hysterectomy, you will no longer menstruate and will not be able to have children. If your ovaries were removed, you may be prescribed hormone replacement drugs. Fortunately, hysterectomy surgery only rarely leads to complications. One potential complication is a persistent residual neuralgia, or pain around the scar. It can be either localized or general. It may develop soon after surgery, or even weeks or months later. Usually it will decrease in intensity with time, but in very rare situations, it can become permanent. A more serious complication comes from accidental damage to the bladder or urinary tract during surgery.